Alaska has a total landmass of 586,585 square miles and constitutes 1/5 of the area of the United States. Within this vast area, approximately 50,000 Alaska Natives live on more than 178 rural villages located as far as 1,300 miles from the nearest regional center. 90% of the villages in rural Alaska are isolated from each other, separated by tremendous distances, vast mountain ranges, stretches of tundra, glaciers, and impassable rivers. Most of the communities are not connected to a road system, meaning that air transportation is often the only means of travel for villagers, and air travel is both expensive and weather dependent. When healthcare issues arise, the isolated nature of Alaska's villages becomes a major barrier. For routine medical or dental services, flying to a regional healthcare facility is often too expensive. And in an emergency situation, bad weather can make flying out of the question altogether, often for days at a time.
My grandfather was my first patient. That was a major emergency, and he actually died before I had any other health aide training. So I was with another health aide that had more experience than me, but he went into heart failure, and we waited all night for a medevac, but the weather was really bad, and I actually heard the medevac plane fly over a couple times.
Since 1990, the population of Alaska Natives has increased by 20%, with Natives now making up 16% of the state's population.
Perfect. Very good, Brad.
In response to the success of the Community Health Aide Program and the increase in caseload, there was a significant increase in federal funding for the program throughout the 1980s and well into the 1990s. In 1988, funding was $5.5 million. By 1997, that number had increased to $23 million. Annually, this additional funding provided for many positive changes in the statewide program. The total number of aides increased. There was increased equity in salaries, benefits, and training, and the number of faculty positions and student slots at training centers increased. But even with the additional federal funding, rising medical costs, increased patient load, outdated facilities, and a severe shortage of trained personnel continues to be a problem throughout the CHAP program. Of all the problems brought to light at a recent training program in Anchorage, the shortage of trained personnel was the most pressing.
All this experience I've had, it seems like we need more health aides. There's two of us working, and out of the two of us, we take turns running to the phone, wondering whether it's a doctor calling. The majority of the time, the patient's family are calling, and one of us have to be with the patient at all times, and it's really hard for only two people to be working.
We have been seeking the past 2 years for a full-time PA, physician assistant, and we're still trying to secure, if not a physician assistant, a nurse practitioner, RN, registered nurse to cover our clinic, and it's been pretty hard trying to have services for the community.
We are your doctor, we are your nurse, we are your pharmacist, we are your lab technician. We see every baby that comes in. I've delivered a baby. We do immunizations, we do PAPs, we take care of everything that you need. We are your counselors, we make appointments for you. And you know, it's funny when you go to a hospital and you have to go see every other person to get all of that done in one, and we do everything for you right there. And you're lucky to have us.
In many villages, there is only one health provider to serve the entire community. The responsibility of being on call 24/7 causes tremendous job stress. This stress is accentuated by the close relationships in the village, as more often than not, the patient will be a close friend or family member.
Our experiences, the hard ones are dealing with family, emergency-wise. Being from a small community, you are almost related to everyone. That's the hardest part for me.
While Alaska is losing some of its most experienced community health aides from the graying of the profession, additional losses stem from frustration or plain burnout.
Our jobs are so stressful. We work 7-8 hours a day, and then from that time after that we go on call, and we're on call on the weekends, and there are a lot of times that we're expected to do more than we are taught. There are a lot of times we have to do more than we are taught.
To maintain suitable health care in rural Alaska, we recommend an increase of 25% more providers, or 125 positions, which will cost an additional $6.1 million annually. A shortage of field supervisors is another pressing concern for the Community Health Aide Program. Field supervisors are a critical element in the program, providing administrative, clinical, and psychosocial support for the health aides. While the number of community health aide providers has increased over the past several years, the number of supervisors has not. Presently, the ratio of villages and community health aide providers to field supervisors is so high that none of the essential components of supervision are being well attended. There is an estimated 20% shortage of field supervisors at this time. Add this number to the 25% planned increase in community health aides, and this result is a need for 23 additional field supervisors. Each supervisory position will cost approximately $100,000 per year, creating a need for an additional $2.3 million per year for these supervisors. The foundation of the entire Community Health Aide Program is based in training centers. In fiscal year 2000, one training center closed due to lack of funds, leaving only 4 centers located in Anchorage, Nome, Sitka, and Bethel, with a combined capacity of 208 training slots. Presently, there is a projected need for 285 slots in the training program. The recommendations for increasing the capacity of the training centers are twofold. First is the need for an additional training center with an estimated cost of $800,000, and second, it is recommended that an additional faculty member be hired for each existing training center to increase their ability to do recredentialing and continuing medical education. The 4 additional faculty members would cost $400,000 annually. For more than 30 years, local Native community health aides have been delivering primary health care to the people in their remote villages. Community health aid services are a sustainable, effective, and culturally acceptable method for delivering health care. Community health aides provide health care with a continuity that could not be matched by any other providers who would move in and out of the village. This program has demonstrated adaptability to advances in medicine and the evolving health needs of the population, and it does so at a comparatively low cost. Adequate funding is needed to assure that the Community Health Aide Program continues as a foundation of health care delivery to rural Alaska Natives. It is our recommendation that an additional $15 million annually is necessary to ensure the integrity of this program.